Hello, 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 hello. Welcome back to my channel. Thanks so much for joining and for watching these videos. I am greatly appreciating the love and the support that you guys are giving me. And most importantly, I'm so glad that I'm able to help you guys out on your journey, whether you are looking at medical coding as a potential career path to take, whether you're studying for your CPC exam, or if you're a veteran coder who's switching specialties and get into HCC or just other things about coding than what you've been typically used to as a coder. I just thank you for watching. I'm glad that these videos are able to help you out. So don't forget, as we get into the video, don't forget to like, to comment, and subscribe to these videos so you'll know when they drop. They'll be in your news feed. And also click the notification bell so you'll know as soon as I drop the video, you'll be the first to know. So let's get into it. Today we're going to talk about CPT modifiers. I've been noticing a lot of people also been asking me to do videos on modifiers. They've been having trouble with modifiers, when to apply them, when not to apply them, why do we need them, things like that. So when you're using modifiers, they're basically explaining any additional things or anything that was added or decreased from the service that was performed. So that's what modifiers are used for. If it's an increased service, then we have a modifier for that. If it's a decreased service, if a patient was going into surgery but something affected the surgery so the patient could no longer have it, then there's a modifier for that to let the payer know that this patient was ready for surgery, they were scheduled for surgery, but there was a complication and it was not performed. Let's go ahead and get into the video. So today's video is going to be about modifiers 22 through modifiers 26. And this presentation will also be available for sale. It's only $3.99. I'm not trying to get rich off the presentations or anything like that. So I'll drop the description in the, I'll drop the link in the description box where you can go ahead and click the link and you can get this presentation for only $3.99, and you can get the, watch the video and kind of follow along with it. You can also have this as a quick reference when you're working or when you're in school, as far as knowing when to use these modifiers. So modifier 22. Modifier 22, and this modifier indicates that there is an increased procedural services that's included. And this is used when the work is required to provide a service is substantially greater than typically required. And I'll break all of this down as well. I won't leave you guys hanging with all these words, and I'll just break down the total process as well. The documentation must support the substantial additional work and the reason for the additional work. Example, if it's increased intensity, if it's increased time, the technical difficulty of the procedure, the severity of the patient's condition during the procedure, the physical and mental effort that the physician needed to get this procedure done. All of that is definitely needed in the documentation to support the usage of this modifier. Do not, and I'll say this throughout the video as I'm talking about modifier 22, do not append and apply this modifier to any evaluation and management services. So if it's an E&M services CPT code, please do not use modifier 22. It is not for this. So if you see it on the exam, then you automatically know that that answer is wrong. If you see a CPT code for an office visit or for an E&M visit, if you see modifier 22 used, then you know that's the wrong answer. So examples of when to use modifier 22. Let's say the patient is scheduled for a hysterectomy with a lumpectomy. The patient is morbidly obese. Now, hysterectomy is when you are removing a female's reproductive parts. You can have a partial hysterectomy or you can have a total hysterectomy. When you have a partial, you might have your fallopian tubes removed. You might have your ovaries removed. And when you have a total hysterectomy, that's when you're going to have the complete uterus and all of the parts removed. A lumpectomy is when they remove a lump or a mass from your breast. And if you notice, and this is a medical terminology thing, if you notice ectomy, hysterectomy, lumpectomy, that's the removal of something. So you can remember that in your medical terminology terms. When you see ectomy, that's the removal of something, some part. So the patient is morbidly obese. So the documentation that the provider should include should say something along these lines. A salpingectomy, which is the removal of the fallopian tubes, require an additional 120 minutes, which is 2 hours, of surgical time before lumpectomy could be initiated. So this physician is basically saying, I had to spend 2 extra hours removing the fallopian tubes before I even started on the lumpectomy. So this physician is automatically letting the payer know that there was an increased amount of service required to perform this procedure. So like I just said, this indicated an increased service, and that's why you're going to use modifier 22. Appropriate use of increased procedural services modifier, which is modifier 22, when the services or service provided is or are greater than usually required for the listed procedure and is not described by another CPT code. A slight extension of the service does not support nor validate the use of modifier 22. So if the procedure of the physician does something that they normally do not do, takes longer than required for this procedure, use modifier 22. Sometimes it can already be bundled within a code. Sometimes the additional work is bundled, and if the additional work is bundled into the CPT code, do not use modifier 22. You're just going to use that additional code to describe whatever that the physician did. Do not use modifier 22. Also, do not use modifier 22 if it was a slight extension of the service. Let's say it was an additional 5 to 15 to 20 minutes. You're not going to use modifier 22 to show that the physician just spent the extra 15, 20 minutes doing this service. That's not enough validation to support that it was an increased service. Remember, if it's not listed within the code, you're going to use modifier 22. Also, in the instance of complications and medical emergencies during the surgical procedure, you're going to use modifier 22 for that as well. Let's just say the patient was hemorrhaging or, excessive bleeding. They start having difficulties in another area while you're having surgery. Just anything that complicates it, you can use modifier 22 if the physician has increased services as a result of the complication. When using modifier, and I'm stressing this because a lot of times people try to use modifier 22 without the documentation, and it does not work like that. So I just want to stress it so I can just drill this inside of your brain. So if I keep saying it, that's why I'm repeating it. When using modifier 22, the claim must be accompanied by documentation explaining the unusual circumstances. The documentation can include, but not limited to, operative notes, pathology reports, radiology reports, progress notes, office notes, and descriptive statements. Inappropriate use of modifier 22. Reporting increased E&M service time, skill, or service with modifier 22. Again, do not report any E&M services using modifier 22. Now, using this modifier on a routine basis, also inappropriate use because it can cause an audit. They're going to be looking like, I know darn well that this doctor is not having increased problems and difficulty in time with every single patient that's coming through this office. You know, maybe they don't know what they're doing if, you know, maybe they don't know what they're doing if they're constantly using modifier 22 for everything. So that's a red flag for payers, and that's a quick way to get audited, and you definitely don't want that. Also inappropriate. Using this modifier to indicate that the procedure was performed by a specialist. Just because the practice is a specialty does not mean you automatically should include modifier 22. Also, applying this modifier to a surgery code without the proper documentation. Because this modifier is often overused, payers may ignore it, so include the support. And that'll keep you from double working yourself. You know, if you send the claim out with the modifier, no support, it's gonna come back denied, and then you have to work it again, send it back out. So just do it right the first time. Also inappropriate. If you bill from a facility, do not use modifier 22 because modifier 22 is a physician-only code. Again, if the additional work is included in the primary code, if it's already bundled, if the code already describes all of this extra work that the physician has to do, then it's already bundled. Use that single code and don't report it separately because it's not separately reimbursable. Or if the surgeon chooses to do something extraordinary, you want to perform something difficult, to just do something when there's a less simple approach, or excuse me, a more simple approach, then they're not going to pay for that. If the doctor just chooses to do something different when there's another option, they're not going to pay for it. Modifier 23. Modifier 23 is when anesthesia is required for a service that usually does not require anesthesia. Remember that. When anesthesia is required for a service that usually doesn't require anesthesia, then you're going to use modifier 23. These are other instances where you're going to use it. When a service which requires local or regional anesthesia, normally, but due to unusual circumstances, the anesthesiologist gives general or monitored anesthesia to perform the procedure. You're going to append that modifier 23. Also, report this modifier in the second modifier position. The modifier indicating the service was personally performed, medically supervised, should be reported in the first column of the first modifier position. And these are examples right here below. These are examples of the of the first modifier position. AA, QK, AD, QY, QX, QZ. This shows whether it was medically supervised, who performed it, whether it was the anesthesia assistant, whether it was the CRNA, whether it was the anesthesiologist, was it the doctor himself. So you're going to use this in the first position for the modifier, and then you're going to add modifier 23 in the second position. Now here are inappropriate uses of modifier 23. Do not report this modifier with procedure codes that include the term without anesthesia in the prescription, in the description. So if you see where it says do not include, or if you, if you see the, if you see the term without anesthesia, if you see that in the description, don't use this modifier. Do not report this modifier with procedure codes that are normally performed under general anesthesia. And I'll say it again. Do not report modifier 23 with procedure codes that are normally performed under general anesthesia. So if this procedure already uses general anesthesia for this procedure, you don't have to put modifier 23. And remember, anesthesiologists, CRNAs, or anesthesiologist assistant, they should submit this modifier to indicate that a procedure that is normally performed under local anesthesia or with a regional block required general anesthesia this time. Okay, moving on along to modifier 24. Now, modifier 24, you're going to use this in an unrelated evaluation and management by the same physician or other qualified healthcare professional during the post-operative period. And you know me, I'm going to explain, and I'll go deeper so you'll understand what this modifier is used for. So this modifier reports services during the post-operative period, which are unrelated to the surgery and should be considered separate from the surgical package. You know, when you have surgery, there is a surgical package. And that surgical package, I think usually includes 60 or 90 days. I'm not sure right now. You can look up the global package. But inside that package, it includes the preoperative visits, intraoperative, and the normal follow-up care services during the post-operative period. And most services related to the surgery during this period gets included into that surgical package. So let's say, for an example, I'll go deep. So let's just say I had hip surgery. So if I had hip surgery, and if I'm within that global package period, whether it's 60 days or 90 days, I can't think right now because I'm one subject at a time. So if I go to the doctor, if I have surgery on my hip, and if I go to the doctor during that post-operative period, and I'm having issues with my hip, then that's included in the package. That's included in the surgical package or the global package. So they won't get any additional reimbursement for seeing me with issues about my hip because I just had surgery. It's already included. It's bundled. You remember I talked about being bundled? So it's already included. So they can't get any extra money for that. However, if I have hip surgery, and if I go to the doctor and I'm complaining of a fever, that's separate. That's a separate service. My fever has nothing to do with my operation to my hip. So to let the payer know, although this patient is coming back to visit us, is coming back to the doctor during their post-operative period, and we already know that most visits during the post-operative visit are paid for. However, the patient's visit this time has nothing to do with the surgery. So we need some separate money for this visit here because it has nothing to do with what you already paid us for. We need a separate check for this. This is a fever. It has nothing to do with the hip. So that's when you use modifier 24. When the visit is unrelated, make sure it's billed separately. Modifier 25 explained. Now, I used to work for OBGYN. I used to do surgical coding, of course, like deliveries, any kind of urogynecology procedures, just anything dealing with OBGYN, whether it's inpatient or outpatient. And modifier 25 was the most used modifier in the office that I use working in the OBGYN. And I'll explain when and why this modifier should be used. So when to use modifier 25? When two separate services, including an E&M service and a procedure, is performed together on the same day by the same physician or other qualified healthcare professionals, modifier 25 is reported only to the E&M code. So, you know, on the claim, there are different lines. So when you are reporting the E&M code, next to the E&M code, that's when you're going to put modifier 25 to let the payer know, in addition to this office visit, there was another procedure performed on the same day by the same doctor or another healthcare professional that's qualified. If you forget to use modifier 25 with the E&M CPT code, the payer will include the E&M service in the payment of the surgical procedure or the procedure. Using this modifier increases the potential of receiving payment for this separate service. Let me give you an example. The patient comes in for hypertension follow-up. You know, HTN, medical terminology, stands for high blood pressure or hypertension. So the patient comes in for hypertension follow-up, and during the exam, the physician is feeling around on the patient's pelvis and the abdominal area, and the physician feels a mass. So the physician orders an ultrasound to be performed in addition to the office visit. So in that instance, you're going to append modifier 25 to that E&M code to let the payer know, not only did this patient come in for an office visit, but we also performed another separate procedure that had nothing to do with it, and we want to get paid for that as well. Modifier 26. So when I explain this modifier, you're like, oh, okay, I get it. So modifier 26 is used to indicate the professional component of the service being billed. It's letting them know that it was interpretation only, and it is most submitted with diagnostic tests, including radiological tests and procedures. And you must enter this modifier in the first modifier field on the claim. So let me give you an example of when to use modifier 26. A patient receives an X-ray at the hospital by the radiology tech or the X-ray technician. The tech is not qualified to read the results. It must be a medical doctor, and usually the radiologist, who reads the results. Whether you're reading the results for a doctor inside of their hospital, or if a physician referred a patient to a place where they only do X-rays. Then once that radiologist reviews the results, reviews and indicates and give the results, they're going to send it back to the doctor who referred their patient. So the radiologist does not want to get paid for performing the actual X-ray, because they didn't administer, they did not give the X-ray tech did. So they don't want to get paid. That's going to be something that the facility is going to charge for. So that specific physician does not want to get paid for the performance of the actual X-ray exam. They didn't do it. They want to get paid for reading the results. They want to get paid for sitting down, looking at the results, interpreting it, reading it, and sending it back. So that's when you use modifier 26, when it's for interpretation only. When you're saying that this physician did not perform a procedure, they only interpreted the results of this diagnostic test. So thank you so much for joining me. Like I said, I will, in the next video, I will do modifiers 32 through modifiers 59. Thank you so much for all of the support and for joining. Again, I'm glad I am able to help you on your journey. And don't forget to like, to comment, and subscribe. Also click that notification bell so you'll know every time I drop a new video. Also, don't forget to click the link in the description box to purchase this presentation for only $3.99 on a site called Gumroad. And you'll see the link below. So again, thank you so much for joining me, and I hope this video was very helpful to you in understanding modifiers.